like Joe and myself, we're both medical doctors, but we want to contribute to our community, and the best way we can is by informing and giving information. So without further note, welcome to another edition of the Dr. Selwyn Howard Show, where we try to provide our audience with the latest advances in medicine by giving access to some of the top medical providers and community advocates in the country. Tonight's edition is no different. We come to you all with our first video. We've been doing audio. If those who followed us for a few sessions know this is something new. So we're stepping up a little bit because we got some prime time players tonight. Our first guest is Dr. Joseph Saulsbury. He's a board certified family medicine doctor who's practiced medicine for over 25 years in the Atlanta area. Joe is highly involved in his community and is currently in practice with WellStar Medical Group Urgent Care. Welcome to the show, Joe.
Thank you, Dr. Howard. Thank you, sir. Thank you, Lonnie, for being on. It's a pleasure. So, and we go back some 35 years, not trying to tell our age for the audience, but we've known each other, man, since August of 1983.
Wow.
So,
we have a little seasoning behind us.
Exactly. So I'm very happy. I'm very thrilled and humble, honestly, to be on your show. You've done great things in your career. Great family man, great capital man. So with that, I will defer the floor.
All right, well, it sounds like you can keep talking there, Joe. I'll take all the accolades. But our next guest goes even a little farther than Joe and I. Attorney Lonnie Washington is a noted attorney in the Birmingham, Alabama area. He was born and raised in that great city called Bessemer, Alabama, and has been practicing law in the Birmingham area for almost 30 years now. Joe tells me he's venturing also into investment banking, and he also has started his own internet radio program. To be honest with you guys, Lonnie was the person who kind of talked me into doing podcasts. I never even had a clue, but he approached me about doing it, and we're taking this and rolling with it. Recently, Attorney Washington was an adjunct professor at Miles College in the criminal justice department at their law school. Welcome to the show, Attorney Washington.
Welcome, Dr. Howard. I just want to give you a shout out. Dr. Howard was always one of the guys in high school that you knew was going to be somebody. He was very serious, very studious, very nice, pleasant person to deal with. I'm just so proud that my homeboy has done so well.
I'm proud of you as well, my friend. I'm proud of Dr. Saulsbury also. We all come from the mud, as the young folks like to say. Dr. Saulsbury is a native of Columbus, Georgia, which is an annex of Phoenix City, Alabama.
Correct.
All right, so let's get on with the show here. Dr. Saulsbury, we're gonna start with you. You and I have done a few shows about COVID-19 with our fraternity brothers, and all three of us are proud members of Kappa Alpha Psi Fraternity Incorporated. We've given lectures to the Grand Pi chapter of Morehouse College, trying to get those guys the latest information. We've also connected with our classmates, Spelman and Morehouse class of 1987 recently. Since that time, Joe, the vaccine has come out about 2 weeks ago. I know that you received yours a short while ago, and I received mine about 10 days ago. Tell us a little bit about your experience receiving the vaccine, and also, since you're in family medicine, you deal with a lot of patients. Tell us what their thoughts about this vaccine is.
Well, first and foremost, Dr. Howard, I got my vaccination last Tuesday. I think that was the 22nd of December with WellStar Medical System here in Atlanta, who I work for. I do urgent care. And so they open it all to the frontline workers, obviously physicians, mid-levels, nurses, everybody else involved in the hospital system who for the last 8 months have been stressed given this pandemic. So it was welcoming. I'm looking forward to my second dose in the next 2.5 weeks. Hopefully I have 95% immunity. Attorney Washington, I know you're looking at those numbers. So that's what Pfizer says. So hopefully we'll get to that point. But to double back on Dr. Howard's question, I do urgent care for the healthcare system. So my family medicine duties, even though I'm a diplomat at the American Board of Family Medicine, sort of been removed. I've been doing urgent care. So I do a little bit more high intense things outside of family practice for the system. But I will tell you right now, we've tested more people in the last 2 months than we have during the whole entire pandemic, if you can fathom that. People have been coming in since before Thanksgiving to be tested so they could be with their loved ones. And certain last 3 weeks, people have been coming in to be tested to spend the holidays, Christmas and New Year's. Now, having said that, right now, I'm not so sure on how to gauge who is going to want the vaccine or those who have questions and concerns about the vaccine. Right now, I think last numbers checked, there were 12 million doses released in the past 2 weeks. And as of today, we have less than 3 million people in the United States who have gotten it. So we have a gap of about 9 million doses. So again, Dr. Howard, your question is very poignant in the sense that I don't know if it's an access issue or if there's a trust issue. So, we will know that going forward into the new year because WellStar, along with other hospital systems, will start offering this to our family and our friends. So we'll see at that point in the next several weeks if the vaccination, those numbers go up.
And Attorney Washington, I'm going to hit you in just a minute, but to add on to Dr. Saulsbury's point is that I think there's quite a bit of hesitancy. You get it from lay people, you get it in the health community. I've had several nurses and midwives and other what we call mid-tier level providers who come to me and say, Dr. Howard, I'm going to see how you did with it. We're going to basically make you the guinea pig. And then if you do well, I'll be ready for the second or third run. So there is some hesitancy. Our African-American community, we have a long-standing history, which is very validated as to why we have hesitancy when it comes to vaccines, and we'll cover that. But I think that's around the board. I mean, I deal with all types of people, different ethnic backgrounds, and you get that from across the board. It's whites, it's Asians, it's Indians as well. So there is a certain amount of hesitancy with this vaccine. So with that being said, Attorney Washington, you have a little, your family history is one that needs to be talked about. You have, you think your grandparent was involved in the Tuskegee trials that they had with the syphilis. Could you kind of expound upon that, please?
Sure, Dr. Howard. And before I expound, I just I want to thank the African American medical professionals for the sensitivity that you guys have displayed in addressing these issues. As medical professionals, it would be easy for you to be cavalier and just say, trust us and take the vaccination, but to have the sensitivity to want to address the underlying trust issues in the African American community, I just say kudos to you guys. But as far as my family history, my maternal grandfather was a resident of Macon County, Society Hill. It's right outside of Tuskegee, and he was a member of that Tuskegee syphilis study, where he was untreated after he unfortunately contacted syphilis, which a lot of rural Black Southern men contracted maybe because of less than hygienic practices and certainly less responsible medical care that they were given by the white doctors in that community. There were very, very few African American doctors in Alabama during that time of the American history experience. And so he was left untreated, and it, it had secondary effects on my grandmother. And I don't have to go into that being a married couple. It had secondary effects, and it left my grandfather scarred, physically scarred, and it left a deep distrust in my family legacy and history toward doctors, particularly white doctors. And then because of the industrialization of Alabama, the family moved from Macon County to Bessemer for the iron industry, the steel industry, the coal mines. Those jobs simply just paid better than being a sharecropper. Birmingham offered more social mobility, less white racial political superiority than the rural South, such as Macon County. It was just more opportunity. And so he moved to Birmingham, Bessemer area, Jefferson County. And then, he and some of my uncles contracted black lung in the coal mines and different industrial occupational diseases associated with steel mills and coal mines. And unfortunately, there's empirical evidence that those black industrial workers received less healthcare benefits, healthcare, than their white counterparts, but once again by white doctors in these industrial organizations. And so, suffice it to say, there's a legacy in history of my family of just distrust, and I don't think my family is any anomaly or any in the African American community or is anything special. I think we're just sort of a microcosm or an example of what happened to the agrarian black sharecropper who evolved into the industrial black worker. Just a legacy in history of just not being treated.
I agree with you. I think my background is similar. My grandparents were sharecroppers as well. They moved to the Bessemer, Birmingham area, United States Steel, U.S. Pipe, the Pullman Standard. So there were better conditions, whereas a lot of history, a lot of people know that people moved up north for industrialized jobs. Alabama was the new town of Birmingham, provided those things where you didn't have to go so far away from your family. But as we all know, Birmingham was wrought with a lot of bias and a lot of oppression still for those people in that age. We had the towns where they were couldn't come out at night. Different things going on. So we're trying to make that better to get past that point. And people like yourself, Joe, myself, we're all in our 50s. We're trying to be that post-civil rights era of people who went out there, and then we try to push things forward, and we're going to carry that torch to the next set of people who come out strong with their stances this summer. George Floyd brought a lot of people, a lot of different cultures out there standing strong because, again, the internet, although it has its negatives, it has the pluses of you can't hide things. I think things that are in the light are definitely showcased a little bit better. And that's what I think with this vaccine. It's in the light. It's not hidden. It's not just segmented toward one sect of people. Everyone is taking it. Dr. Fauci is taking it. President-elect Joe Biden is taking it. So you got different people advocating taking this vaccine. I think we need to see that more. And I think people have to trust science, and it's not easy with your background, especially Lonnie, your family history. There would be apprehension because, again, you're telling us you left, your family left the rural area of Tuskegee, moved to the more industrialized area, but things were still not how they should be. So exposure is what we're trying to do. Joe, I'm going to go back to you and tell me, what do you think is going on with your patients? Do they talk to you about the vaccine and what your thoughts are? Are they clinging to what you're saying, or what are you hearing?
Well, a couple of things. We've been on a lot of mass testing in the last several weeks, like I said earlier, for people who want to be around their family and travel and things on those lines. And I think at the end of the day, a lot of it stems around, Dr. Howard, whether or not, like Attorney Washington said, how safe is the vaccine? I had a couple of patients tell me, even my staff, I think we talked about this offline earlier, they were a little hesitant about taking the vaccination because they said it made it in less than 8 months. One thing that a disclaimer must be made is that we, the country, United States, the FDA, CDC, who they've known about COVID for the last 6, 7 years. The issue here in America is that the current administration, soon to be the past administration, they took shortcuts. They defunded CDC.
Right.
They defunded the FDA in terms of research in virology.
Right.
So SARS has been around for the last 13, 14 years, in addition to COVID. So the research has been there. They have been able to isolate this virus in real time in laboratories in and around DC and other industrial medical places here in the United States, other pharmaceutical companies. So the research has been there. So the blueprint's been there. So I think what they've done in the last 8 months is to capitalize on that research and to speed things up. And thankful to a lot of Americans who volunteered. I mean, we've had over 40,000 patients collectively thus far. I don't know the actual breakdown of African Americans, but we've had a number of people, and 40,000 people in less than 8 months. That's a pretty significant number when you think about a random clinical trial at this short notice. So I think the science is there, and we'll just have to wait and see just how the numbers translate going forward.
Dr. Howard,
Go ahead, Lonnie.
I want to say, I certainly believe that that the trained medical professionals have to be trusted, particularly the African American. For me, have to be trusted because I believe in empiricism and the training and the education. This is not the medieval times, and so I believe in medicine. And now as a Baptist, also my religious beliefs also play a role in that too. But I, first and foremost, I believe that the trained medical professionals have to be trusted. But even during the Tuskegee syphilis experiment, it was the United States Public Health Service and the Center for Disease Control that directed these experiments. And so even those venerated organizations have a legacy and history of racial bias.
That's true. The thing too, though, I think we have to look and see how has the needle moved forward. And I think if you go back to those years, you had the FBI, but they were J. Edgar Hoover was over the FBI. You had a lot of different people that had other different thoughts about what they thought was fair and equal. So, as again, I think we have to pass that baton forward. I mean, during that era, we couldn't go to certain restaurants. We had to go to the back of the bus. There were colored and white restrooms. So the needle has moved. And again, I think protest, which has its value in America, it definitely gets people heard. But once you have protests, you got to get people inside. You got to have insiders who are able to sit down and be a part of these studies and see the research and be able to say, look, we've been doing this. I know that this for a fact is what it is. So when you have people who are insiders, then there's a better chance that you get a chance to see a fairer view. That's the only thing I like to see in the country. I'm used to a fair group of people. You have to push people for that fairness. But that's something that you have to look for, and it's advocated. And I think that's where we're going forward with this. So, Joe, just to go back to you, safety and efficacy. You were saying something about 95%. Tell the audience a little bit about that.
Okay, real quick. Let's go back to actually the molecular level where we are with these vaccines. So right now, Pfizer and BioNTech are the ones that I received. Moderna just got the emergency use authorization late last week, early this week. AstraZeneca, Oxford, that's the other vaccination that is big in Europe, which will be really distributed across the rest of the world. You have Johnson & Johnson, which is still in their clinical phase 3 trials. Hopefully they'll be available here soon. And then we had the other vaccination yesterday, the Movax, that is supposedly going to be around as well. First of all, the way this vaccination works, it is being carried by messenger RNA, mRNA. So basically what this does, this allows the vaccination to have messenger RNA lead or bring about looking for the spike protein on the coronavirus membrane, attach and start to replicate neutralizing antibodies, which will thwart or decrease the actual virus replication in your body. So that's simple virology 101. So the actual way that the Pfizer and the Moderna work is through messenger RNA, whereas the actual AstraZeneca, Oxford vaccination works in England and across the world is really through simple rhinovirus or simple cold vectors. So actually, that's why you have a more need for the Pfizer and Moderna virus to be kept at a lower temperature, a colder temperature, so that this type of messenger RNA can be expressed. So having said that, I think right now, to answer your question, right now the preliminary results is that once you get the second vaccination for both the Pfizer and the Moderna, you will be around a 90% threshold of being able to protect yourself going forward in terms of getting COVID-19. With the AstraZeneca Oxford, I think it's around maybe a 75, 80% threshold of protection. So we will know whether or not this is efficacious in the next 6 to 9 to 12 weeks on a global perspective.
Lonnie, did you want to add anything, any questions for the good doctor or myself, or any of your thoughts that you may have right now?
He's way above my level of understanding as far as science. That's way above my pay grade to try to explain what he just said. So he's a subject matter expert, and I'm gonna respect that.
Okay, all right, very good. So as far as the you were saying about, you said about 9 weeks, 12 weeks, we're gonna find out. Tell us, a lot of people want to know this, Joe, and it looks like I'm having a little video difficulty with my screen right now, but hopefully you guys can hear me very well. The estimation of returning to normalcy. Talk to the audience about how that plays a part in people getting vaccinated, so we can get to a point where, you know, you hear this term herd immunity. Talk about that and us all returning to normalcy with that.
Yeah, herd immunity is real simple concept. Basically, it refers to the gross number of people who are affected by a particular disease or illness that can offer a natural immunity in a relatively short period of time. In theory, you go back to the flu in the late 1900s. Basically, what was found out,
I found this on the web for go back to the flu,
was that essentially the more people in the United States at that time could be exposed to the flu at that time, it would be better off for a gross number of Americans to be affected in terms of being able to get through those difficult times. Obviously, you had a lot of deaths. I don't have those numbers at the top of my head, but you had a lot of deaths when you think about herd immunity, hence the term vaccinations. So vaccines are actually used as a bridge to get to herd immunity. So the more people who are vaccinated against a certain particular disease or illness, then that means that the overall protection of those people are increased. So they give a number grossly around 70 to 75% of people who either need to be exposed to the disease in a natural progression, or people who need to be vaccinated to help get to that point. So we're sort of on the cusp, gentlemen, on where we need to be with herd immunity. So right now, if we were to wait for over 300 million people in the United States to get to herd immunity, we may not have a whole lot of people left. So vaccination is sort of the bridge to get us there in a safe and effective manner.
Dr. Saulsbury, thank you for that explanation, because I've always confused the two. So I thank you for that. That sort of crystallized in my mind. But Dr. Howard, I have from a lawyer standpoint of view, I have a concern about the manufacturers of these vaccines being given federal immunity.
Yes.
As the attorney in me tells me that could be problematic. I remember 2001, 2002-ish, there was this drug, Vioxx. It was a non-steroidal anti-inflammatory drug.
Yeah.
And, no disrespect, please, with all due respect, the pharmaceutical companies were giving this to doctors, and they were giving doctors junkets around to exotic places to push this stuff. And you took it, and there was all kind of heart attacks and strokes. That was my first foray into products liability mass tort litigation. And so I was a young, aggressive lawyer back then, and learned a lot about the FDA drug approval process, the FDA drug approval process, and how this particular drug, Vioxx, which is just one, it was Vioxx, Bextra. They were sort of, they were not sort of, they were green lighted. The normal FDA regulatory overview process was shortened because of political pressure, because of the tremendous political pressure that the pharmaceutical companies could bear on Congress. And you just, I mean, just terrible deaths and heart attacks and strokes. And that was, I said to say, that was federal preemption. That was one of the issues that the plaintiffs' lawyers were fighting for, is to, that's what the pharmaceuticals company wanted, is a federal preemption, that you couldn't sue in a state court. You'd have to sue them in federal court, and it was such a high bar. And so in a similar vein, I see where the pharmaceutical companies are asking for federal preemption for these vaccines. And I think from a lawyer's standpoint of view, I think that could be problematic to give them carte blanche because of the public necessity to try to resolve this pandemic. And I just, as doctors, I'd like your input on it. That's all.
Well, I think you're on to something. The American free enterprise system has a few flaws. We're still, I think, the greatest country in the world, but greed has never not been around. So people will put their hands out, and that's something. I mean, you said that Dr. Saulsbury was above your pay grade. Well, this is above my pay grade when it comes to the legality of things. But you're right. I mean, there has to be something looked into that because granting immunity like that gives somebody almost carte blanche, and you have to have checks and balances. So I will agree with you on that. So what do you think about what he's saying?
I agree with Attorney Washington whole heart, but the issue here, though, is that when the FDA issues emergency use authorization, that means that they're granting the use of a drug that hasn't truly met all the criteria that they feel will help prevent any negative outcomes. But because the demand is so great at that times in terms of deaths and illnesses, they are allowed to use this in emergency use, hence the term EUA, emergency use authorization, to help, sort of alleviate the long-term effects of what these medications may help during a situation like these.
Dr. Howard, Dr. Saulsbury, these pharmaceutical companies are going to make tremendous profits. Tremendous profits. I mean, they're doing it for an economic reason. We know that it has a side effect of a very noble humanitarian reason. But at the end of the day, these pharmaceutical companies are in it for the money, and so to allow them to make these kind of profits without any concern for legal liability, to me, that's just sort of unconscionable. That's just sort of unconscionable. There should be checks and balances. I know it's a pandemic. I know it's for the greater, ostensibly, it's for the greater good of humanity. But let's not be, Pollyannish. They're going to make a lot of money off doing this, and I think there should be some kind of a liability if this vaccine or vaccines, as Dr. Saulsbury explained, cause irreparable harm to the public.
Yeah, I hear what you're saying. I think too, though, in medicine, we always look risk versus benefits. The risk versus the benefits. Right now, we're in the throes of the biggest pandemic that we've had in 100 years. And it's gotten worse because we've had irresponsible leadership at the top, making politicized and wearing masks, politicizing all of these things, which slowed the process, and it dropped the guard for a lot of people. It made them a little more assured than they needed to be. So we're in a very bad situation right now. You're just seeing people left and right that are dying that I mean, I know a urologist who just passed away this past week from COVID-19 in his 60s. There's some other people who had it as well. So it's like even people in the medical community allow the politics to creep in, and things that seem so basic and just using your common sense, people aren't doing that anymore. So I hear your point, Lonnie, but I think at the end of the day, the benefits of getting this vaccine so we can get a hold of this virus before it really tears up our community even more. So I have so many people calling me, my son, daughter, and my husband, they all have COVID now. Dr. Howard, what do I need to do as far as my living situation? So there's a lot of untold stories because a lot of people still don't want to admit that they've had COVID because there is a stigma in certain people's eyes with people who've had COVID. So COVID may be a little more, the percentages may be higher than we realize, but a lot of people don't want to talk about it. I've had even people who work with me, they come back a few months later, oh, my wife had it, I had it, but they didn't tell anybody. So the numbers are higher than we realize. And we keep things under the rug. Nobody wants to admit that they're the person. Some people will, but I think we've got to the point where it's such a travesty and a race to destruction. If we don't turn it out, it's going to be far worse than we can imagine. So that's my thoughts.
Dr. Howard, may I?
Go ahead, sir.
Just sort of, and I don't want to belabor the point, but just sort of the inherent duplicitousness of this preemption. Mm-hmm. So the consumer, or the patient could be prevented from suing the manufacturer. Okay, but I've seen this in other mass tort litigation. But What about the shareholders? So say the shareholders of just say one of these companies, I don't want to name one, they found out that these drugs got green lighted, or the fast track FDA approval, they caused harm to people. Okay, these institutional investors, pension funds, insurance companies that invest in these drug companies, they can bring shareholder derivative suits. They can bring litigation against these drug companies under what they call a shareholder derivative litigation. In other words, they're saying we wouldn't have invested our pension funds in this drug company if we had known that these drugs were going to hurt people. Because we have all these lawsuits, these lawsuits around the country, that dropped the value of our shares in your company. Does that make sense? It dropped the value. You see that
no doubt.
in litigation against like automobile manufacturers. Like for example, Ford Pinto, when that turned out to be a disaster, you had all kind of institutional investors in Ford that sued Ford under shareholder derivative action. And so what I don't see is I see the actual consumer of the medicine being precluded from suing the manufacturer, but not the big institutional investors in the drug companies. They'll have their day in court. Okay, and so once again, I see an economic disparity in between power, those who are empowered and those who won't be empowered. And so that's a legal concern that I have, that it has nothing. Well, it has everything to do with medicine, but maybe that's just a little twist of nuance that.
Yeah. Well, your concerns are very valid. I mean, economics and money rule the world, and they are a driving force. That is no doubt about it. I think Joe's and I point, we're advocates of people having access to the best medical care. We have health concerns, but that's why we also consult attorneys, because there's also always a spin on things. So, I mean, we could just talk about different things. You look at legalization of marijuana right now. Legalization of marijuana in certain states, if you want to open a marijuana business yourself, from what I've been told, you have to have over $1 million in assets to even think about getting a company. Which again, you talk about economic disparity. These kids for 50, 60 years have been on the street corners selling marijuana and going to jail. Now that there may be a chance to make some money off of it, hey, they've been priced out the game. So you are valid. You are valid in what you have to say. I can't argue that. What I can say though, as a health provider, is I think what can we do to turn this corner? And I think the best thing we have going for us is the vaccine. Any other closing comments, guys? It's been great. You guys have been wonderful. I've learned a lot here from the good Dr. Saulsbury and Attorney Washington. And I hope my audience has learned a lot as well. Joe, some last thoughts about encouraging people to get this vaccine.
It's real simple. And Attorney Washington, I already know your heart as an attorney. You fight for the little man, and I respect that. And I applaud you for that. But let me just say this in closing. This is not a Black thing. This is not a poor thing. This is not a white thing. This is not a feminist thing. It's not a gay thing. This is called COVID. Everybody is at risk. It's not a political thing. It's not a fraternal thing. I think at this point, all of us on this call have known someone to contact COVID-19 at this point.
Yes.
And I pray that whoever you've known, that they made it through. But on the grim side of things, Selwyn and I know firsthand some of our classmates at Morehouse and Spelman who've lost loved ones already. So I tell people right now, and Dr. Howard, so eloquently put it, this is the only thing we have in our armor. We got to put on a whole armor against this devil called COVID. we got to, I'm not a Baptist preacher. I actually believe in the Lord. And I think that was Ephesians, I think I was trying to quote.
Joe, it sounds like you missed your calling, my friend. You sound like you missed your calling, Joe.
No. I'm gonna stay in my lane. But seriously, this vaccine, we'll see. We'll see where we are in 6 weeks to 9 weeks to 12 weeks. I believe the science. I follow the science, and we'll just see what happens.
All right. Anything else, Attorney Washington?
I just want to thank the true subject matter professionals in medicine for your input, your insight, and I trust you guys. I trust your judgment and your opinions.
On that note, we're going to end another episode of the Dr. Selwyn Howard Show. We'd like to thank our guests, Dr. Joseph Saulsbury and Attorney Lonnie Washington, and we'll invite you all back to the show to come back and follow up with us. Let's talk about this COVID. Yeah, Joe, we got some other things we can talk about. Attorney Washington, sounds like we need a little legal advice from you here. So we're going to open up this door. And like I said, on that note, we will see you all in 2021. Everyone have a happy holiday. This tree will only be up for another day or so. So take a look at it and enjoy it. Everyone have a happy holiday. Good night, everybody.
Take care.